Hi, everyone. So welcome to our Bonita's Maternity Program webinar on breastfeeding with Physiotherapist Dominique LeClercq.
Welcome, everybody. So I'm going to start with the importance of breastfeeding. So basically, your breast milk provides protection for your babies. In the beginning, your body produces colostrum. So this is your thick first milk that you make during the pregnancy and just after birth. It is rich in nutrients and includes antibodies. So this really helps with your infant's immunity. It also assists with your infant's digestive system to grow and function. So between your third and fifth day, this is when your colostrum changes into mature milk. And then also formula is harder to digest. And then breast milk fights disease. So this is very unique and it changes according to what your baby is needing at the time. So why is breastfeeding right for you? So with breast milk, babies can smell you and they know the exact unique scent of your breast milk. Life can be a lot easier, so once you and your baby have settled into a good routine, there's no need to sterilize nipples or bottles or any of the other things. It's a lot cheaper than buying formula. The physical contact is very important for newborns, so this will help you bond with your baby, especially in the beginning, and it's good for your health too. So studies have shown that moms that breastfeed, it also lowers the risk for diabetes type 2, breast cancers, and ovarian cancers. So there's a lot of breastfeeding myths I quickly want to get into. I'm sure we've all heard from a family member or a friend of a friend, all sorts of things about breastfeeding, and everyone seems to have an opinion on it. So just to debunk a few of these myths, there's a myth that everyone seems to use formula. So a study in America shows that 80% of women actually start out breastfeeding. So there are a lot more women that breastfeed than you think. 2, it's thought that formula has more vitamins than breast milk. So formula cannot actually match the nutrients and vitamins in breast milk. So breast milk also has antibodies, unlike your formula milk. There's a misconception that breastfeeding makes your breast sag. So pregnancy hormones, this allows the stretching of the breast ligaments. So whether you breastfeed or not, age, genetics, and also number of pregnancies also play a role. There's a misconception that if your breasts are too small that you cannot breastfeed. So the size and the shape of your breast do not affect the ability to breastfeed, and this also doesn't affect your quantity of the milk that is produced. If your breasts are too large or you're plus size, you cannot breastfeed. This is also another misconception. So women of all sizes can successfully breastfeed. So depending on the size of your breasts, you may require a little more practice and find a hold that works for you, but that's easily manageable. There's a misconception that you also won't be able to make enough milk. So moms always make enough milk to feed their babies. A newborn stomach is the size of a hazelnut, so it's very, very small. So as a mother, eat healthy, drink water, and nurse often. Breastfeeding spoils a child. So despite what you've heard, newborns don't need to learn to fend for themselves at such a young age. So breastfeeding provides a unique bond with your child that can really last a lifetime. And the last one is that breastfeeding hurts. So it's not supposed to be a painful process. Although a baby's latch can be quite strong, it's actually not biting. So in the beginning, there's definitely an adjustment period where you need to find a hold and a position that's comfortable for you and your baby, and also give your baby a chance to become skilled at the latching process. So that's why in the beginning it might be a bit difficult, but after a while, once you get used to it, it should not be a painful process at all. So let's quickly look at how your milk is made. So breasts make milk in response to your baby's actually suckling. So the more your baby nurses, the more milk your breasts will make. So your breasts will become fuller and tender during pregnancy. And the alveoli make milk in response to the hormone prolactin. So prolactin rises when the baby suckles, and then oxytocin also rises when the baby suckles. So these two hormones, what they do, they cause the small muscles in the breast to contract and move the milk through the milk ducts for when your baby drinks. The release of prolactin and oxytocin can make you feel a strong sense of needing to be with your baby. So it's definitely a bonding hormone. So just a quick look at the anatomy of your breast. So we've got about 5 different parts. So I spoke about the alveoli earlier. So that's just the grape-like clusters of tissue that make the milk. Then you've got your areola. So that's that dark piece of skin around the nipple. You've got the lobes. So that's also where the part where the milk is made. But each lobe then has your alveoli cells and milk ducts in. You've got your milk ducts. So this is just the tubes that carry milk to the breast or through the breast to the nipple. And then you've got the nipple, which is the protruding point of the breast. So this is where the milk actually comes out. So I'm sure you've heard about a letdown reflex. So what exactly is this? This occurs when your baby begins to nurse. So the nerves in the breast, they send signals to release milk into the milk ducts. This reflex then makes it a lot easier for your baby to nurse and to feed. And it happens a few seconds to several minutes after you start breastfeeding. So this is basically just the signal to the brain to start releasing milk. It can happen at other times though. So if your baby starts crying, or if you start thinking about your baby, or if you're around other babies, it might automatically happen. But there are also many other factors that affect this. So it can be anxiety, pain, stress, cold, embarrassment, smoking, alcohol. So there's definitely a lot of factors as well that affect this reflex. So now the most important part, this is learning to breastfeed. So I really want to stress this to the moms that it does take time and practice. We don't expect you to get it on the first time. And just keep in mind that you make milk in response to your baby sucking at the breast. So that's why it's very important in the beginning or just after your baby's been born to have your baby actually on your chest already, start already with skin to skin. So we've got a few steps that can help assist with this. So as I mentioned now, cuddle with your baby skin to skin right after giving birth. Breastfeed as soon as possible right after birth just to start getting into a bit of a swing of things. If you are struggling or you're not sure about something, a lactation consultant really does help. So you can ask in the ward at the hospital or depending where you've had your baby. Let your baby stay in your hospital room at night and day. This allows for more regular nursing and more feeding on demand as well. We often say to the moms, try avoiding giving your baby a pacifier or an artificial nipple at least until 3 to 4 weeks or until they're skilled at latching or if they have a comfortable latch. So a lot of the times the mom asks me, how often should I breastfeed? So there is no right answer, early and often. So newborns need to nurse at least 8 to 12 times every 24 hours. Remember, every baby is different, so your baby might want to nurse more or maybe a little bit less, but a good guideline is 8 to 12 times per every 24 hours. So this also ensures that the stimulus to the nipple and the breast will produce plenty amount of milk. Healthy babies, they start developing their own feeding patterns. So the first 2 weeks, you'll start seeing what your baby's cue is, when they cry, when they're thirsty. So just follow your baby's cues for when they are ready to drink. So now the latching process. So again, this takes some practice. We say to moms, you can adopt a baby-led latch. So this is where it's a bit more of a laid-back approach, a more natural breastfeeding style, which allows your baby to lead and follow their instincts to suck. So very important, create a calm environment. I strongly suggest a feeding pillow. It's just more comfortable for you as a mom as well as your baby. A supported chair, so that's just a chair with a backrest, and just sort of a quiet room just to rule out any sort of distractions. Skin to skin, so again, I mentioned this earlier, holding your baby against your chest, only wearing a diaper. Hold your baby upright and enjoy this position before you even start trying to latch straight away. Then let your baby lead. If your baby is hungry, they will move their head in search of your breast instinctively. So they can smell your breast milk, they can smell you. Support your baby's head and neck while they search for the breast. Remember, your baby's not going to have any head control. And then just allow your breast to hang naturally. And then when your baby's chin hits your breast, the firm pressure makes them open their mouth, and then they'll reach up and over for the nipple. Now, this sounds all very easy, and it doesn't always go this way the first time. So if the baby-led latch is not working, then I'm just going to give 3 basic steps. So this latching technique would be ideally in a seated position. I will go over the holds after I've spoken about the latching, but in a seated position. So most importantly, you want to aim your nipple actually just above your baby's top lip. So ensure that your baby's chin is not tucked into the chest. You want your baby's chin to extend. Then aim the lower lip away from the base of your nipple. And then what you'll see is when you do this, your baby's lips will actually turn out automatically like a fish. So then the baby will lead instinctively then into the breast, and then you'll see that your breast will start filling your baby's mouth. So the baby's tongue will extend, and then it should be a comfortable latch. Remember, you don't want them to be biting or latching onto the nipple alone. They have to also touch some of the areola, otherwise you have very painful nipples afterwards. So how do you know if you've got a good latch? So it should be comfortable, it should not hurt, it should not pinch. You'll see your baby's chest will be resting against your body, so the head does not turn while nursing, so you can see your baby's also comfortable. You will see little or no areola, so this is also dependent on the size of your own areola and your baby's mouth. You should be able to see and hear your baby swallowing. As mentioned earlier, the baby's lips will be turned out like a fish, and then you'll see your baby's chin is actually touching your breast. So what do you do if you're struggling with the latching? So there are a few sort of challenges I want to go over about difficulty latching. If you or your baby are frustrated, take a short break, hold your baby upright, try skin to skin, and talk and sing to your baby. This should at least calm the environment for you and your baby. If you notice that there's weak suckling movements, so you can't hear your baby swallowing or you can't really see your baby's throat moving, it might mean that the latch is not deep enough. So it might only be on the nipple. So gently break the suction. How you do that is just slide your pinky finger into the mouth, pop open the suction, and then try again. If you're still concerned about your baby swallowing, then I think definitely go speak to the doctor. If your baby is tongue-tied, so this could just be that the tissue attaching the tongue to the floor of the mouth is either tight or short. They have trouble extending their tongue and actually latching onto the breast. You might notice that they may struggle to extend their tongue past their lower gum. If you suspect this, then definitely speak to your doctor. It can easily be repaired or rectified, and then your latching will be a lot more comfortable. Pain, this is a very big factor as well. So you might feel your baby sucking only on the nipple. So break the suction again, as I mentioned, with your finger, and then try latching again. So also look at the shape of your nipple when delatching. It shouldn't be flat or inverted, but rather round or the same shape prior to feeding. So if you notice that when you delatch and your nipple has gone in, prep your nipple, bring it up a little bit, shape it into a cone or a little bit higher, and then try latch again. Another question that a lot of moms ask me is, how long should your feeds be? So there's no set time for feeds. This is again based on your baby's demand, but it can be up to 15 to 20 minutes per breast. If you're concerned that your baby is not getting enough milk, then again, I suggest consulting with your doctor. So I spoke about the latching. So now I'm just going to talk about 3 different holds in sitting. So 3 different ways you can breastfeed your baby, depending what works for you. So all 3 should be comfortable positions, but some babies prefer a certain one. You might prefer a certain one. So play around with them and practice and see which one works best for you. So firstly, we've got our football hold. I suggest this to the moms if they've had a cesarean section. It could be quite painful at the abdomen. Also, large breasts or flat nipples or strong let-down reflex. This position usually works the best. So you will be in a comfortable seated chair, supported back ideally, and then a feeding cushion or a pillow. You're going to have the pillow under, if you're feeding from the left breast, you're going to have the pillow under the left side, and your baby's body will actually go under your arm. So you're also going to support them at the level of your nipple and support the baby's head with the palm of your hand and then latch from that position. Next, we've got our cross cradle hold. So this position is quite useful if your baby is premature or if you've noticed that they've got a weak sucking movement. This also gives a bit of extra head support. So again, in your seated position, supported back, hold your baby with the opposite arm to the opposite feeding breast. So you've got the cushion also supporting your baby, and then just support your baby's head at all times with the palm of your hand. So if you are feeding from the left breast, you're going to be using the right arm to support the baby and the right palm of your hand to support the head. Then lastly, we've just got our cradle hold. So this is quite an easy, probably the most common hold that mothers use. Again, seated position, supported back, cushion under your baby. You're then going to support your baby with the same arm to the same breast. So if they're feeding from the left breast, the left arm will support your baby. So you'll actually use your elbow or between your arm and elbow to support your baby's head. So I'm just going to talk about what to expect basically from birth to 6 weeks. So what happens to your milk, what happens to your baby, and what happens to you. So what to expect right at birth. Your body makes a small amount of colostrum. It gives your baby early protection against diseases. Your baby will probably be awake in the first hour after birth, so this is a very good time to start the breastfeeding process. And you as a mom, you'll be tired but excited at the same time. Then we look at the first 12 hours to 24 hours. So you'll notice that your baby will probably drink about a teaspoon of colostrum at each feed. It is very normal for your baby to sleep heavily. Some babies might even be too sleepy to latch. Feedings will probably be short, disorganized, it's all very new. So take advantage of your baby's instinct then to suck and to latch. As a mom, you'll be tired again, but be sure to rest when you can, especially when your baby is sleeping as much in the beginning. Then just the next 3 to 5 days. So your mature milk then starts taking the place of the colostrum. So it might still have that yellow golden tint at first, but it will start going a bit more whiter as the days progress. So at this point, your baby will be feeding a lot. So the guideline, 8 to 12 times in the 24-hour cycle. And then it's okay for your baby to drink 2 to 3 hours for several hours and then sleep 3 to 4 hours. So again, your feeding can take between 15 to 20 minutes. And then as a mom, your breast might feel quite full and leak. So having pads in your bra might help with that leaking especially. And then lastly, just the next 4 to 6 weeks. So this is when you notice that its white breast milk continues. Your baby will most likely be better at breastfeeding and have a larger stomach to hold more milk. So feedings might take less time and they'll also be further apart. And then as a mom, your body will get used to breastfeeding, your breast will become softer, and the leaking will also slow down. So I just want to talk about common challenges you might pick up in your breastfeeding journey. So here I've got about 7 challenges I just wanted to talk about. So I'll start with the sore nipples. So this is when your nipples are feeling sore or sensitive. You might notice some cracking or some blistering or some ulceration. So as a mom, what can you do about it? So this is very important where a good latch is key. So if the baby only sucks on the nipple, again, break the suction, try again with your latching. You can also try changing positions every time you feed. So see which position works for you best or where you feel the most comfortable. After your baby has fed, express some milk and gently rub it onto the nipple. This will also help with the healing process. And then you can also speak to your doctor for an appropriate nipple cream to put on after your baby's fed. Change your nursing pads often, so this just avoids moisture trapping. And then avoid harsh soaps on your nipples. We also don't want to irritate the skin, and especially if there's a bit of friction or a bit of ulceration on the skin, we don't want any harsh products. And then lastly, especially in hospital. So as a physiotherapist, we provide laser therapy. So this promotes wound healing. So sometimes even on day 1 or day 2, you'll see that there's a bit of cracking or blistering that formed, and the laser therapy just improves and speeds up the healing process quite a bit. Next, low milk supply. So this just means that you feel that your milk isn't coming through. What you can do about it, you can check your baby's weight and growth. So this is often a good indication to see if they're getting enough milk. Make sure your baby is latched and positioned well. As I mentioned earlier, with your baby latching onto your breast, this then kickstarts the hormones and then kickstarts then the milk production. So breastfeed often and let your baby decide when to end the feed. If the breast is not completely empty, pump afterwards. The more you empty, the more your body will make. And also offer both breasts at each feed, just to allow for equal stimulation. And then again, limit or stop the use of a pacifier. And then if you're still concerned, it would be best to check in with your doctor. Oversupply of milk. So this could mean that your breasts are quite full, it's uncomfortable, and it can actually be quite stressful for you and your baby. So again, what can you do about it? So you can breastfeed on one side for each feed. Continue to offer that same breast for the next 2 hours until the next full feeding. If the other breast is too full before you're ready to breastfeed on it, then hand express for a few moments just to relieve at least some of the pressure and that it's not feeling so firm. Feed your baby before they become overly hungry, so this also just avoids aggressive sucking to the breast. So engorgement. So it's quite normal for your breast to become heavier and quite tender initially, especially around day 3, day 4. So this can be the result of milk building up, and it can lead to plugged or clogged ducts and eventually breast infections. That's something we want to prevent. So if you notice that you've got a few lumps or if your breasts are feeling quite full, breastfeed quite often after birth, especially on the more affected side. Self-massage to the breast, that will help a lot just to ease some of the pressure. And then especially when you're returning to work, so pump as often as possible, but don't let more than 4 hours pass between pumping sessions, because this can also lead up to quite a strong build. And then wear a supported bra that's not too tight. So rather opt for support over compression. And then lastly, sometimes if the mothers are a bit longer in hospital by day 3 or day 4, as physiotherapists, we come in and help. So we'll actually feel sometimes some lumps. So we provide ultrasound therapy, massage, and then we also show the moms and help the moms what to do at home when they notice the buildup of milk. That will also be self-massage, warm cloths, massaging in the shower, for example, just at least let down some of the milk there and just relieve some pressure. Then we've got mastitis. So this is when the breast tissue is actually infected. So you'll notice it could be red, it could be quite sore. You also might notice some lumps in the breast, but this usually happens on the one side. So as mothers, what you can do, you can self-massage the breast. As mentioned earlier, you can do a release in the shower and then rest and get extra sleep. If you notice severe redness or you develop flu-like symptoms or fever, then it's quite important that you consult your doctor immediately. They will most likely put you on antibiotics and then refer you to physiotherapy for ultrasound, massage, and then we can assist further. But it's quite important that you consult the doctor immediately if you notice any flu-like symptoms. Then we've got a fungal infection. So yeast or thrush, this can form on the nipples or actually in the breast, but most likely it's on the nipple self. So you'll notice you've got pink flaky nipples, achy breasts, shooting pains after feeding, sore nipples. So I suggest you change the disposable nursing pads often. Wash your clothes often, wear a clean bra, boil your pacifiers and toys that your baby might put in their mouth, and also boil breast pump parts, so just to make sure it's nice and hygienic. Nursing strike. So I've had a few moms that have experienced this. When the baby has breastfed well for a few months and then suddenly begins to refuse the breast, this means that your baby is trying to tell you something. It could be pain from teething. There could be a fungal infection or cold sore, ear infection. Your baby might also be upset if you've maybe returned back to work and there's a bit of a long separation from you, or they could be reacting to stress or overstimulation. So very important, what can you do? So if your baby has started with the nursing strike, continue to express the milk as often as you would breastfeed. So this is just to prevent the buildup of milk and prevent engorgement. Try different positions. If your baby usually chooses one hold, change up the position a bit, start with skin to skin, and then also just limit the distractions in the room. Quiet room, skin to skin, have your baby rocking with you and see if your baby then will calm down or maybe start latching again. So I get quite a lot of common questions. So moms often wonder if they should supplement with formula. So if you supplement your baby with formula and you're breastfeeding, this can cause your baby to not want the breast milk as much. A lot of moms have asked me, does their baby need cereal or water? So for the first 6 months of life, only breast milk is actually needed unless formula is required or as directed by your doctor. So that will be discussed with your doctor. In terms of what medication you're allowed to take when you're breastfeeding, so very important to discuss any medication you want to take with your doctor because there are only some medications you can actually take. And then birth control. So there's another common misconception that breastfeeding is a contraceptive. That is false. So breastfeeding can delay ovulation, but it doesn't mean that it will stop ovulation. So it's important to again discuss then your birth control with your doctor while you continue breastfeeding. Then regarding the pacifier or a dummy, at least try wait 3 to 4 weeks before you introduce one if needed. And then regarding vaccines, so even though your baby is breastfed, it has antibodies, very good for your baby, vaccines are still very important. Breastfeeding actually helps your baby respond better to the immunizations. So the two can go hand in hand together. So now breastfeeding if you've got twins or multiples. Very important, first and foremost, I would say reach out to other support groups with moms for support. It may not be easy, but it's definitely doable. So the more milk you express, the more your body will make. So sometimes what happens if you have twins or multiples, the baby might have to be in the neonatal ICU for a few days. This means you must start expressing as soon as possible. So although your baby cannot latch immediately, you need to still express to make sure your milk comes in, and then also that they can give that milk to your baby in the ICU. So have each baby feed from both breasts. If you want to make it a bit easier to remember, assign a breast to each baby and then switch it for the next feed. So switching sides also helps maintain your milk production. So for example, if one baby isn't drinking as well as the other one, you don't want one breast to produce or supply less milk. So constant switching will also help just maintain a nice balance. Then pumping and storing milk. So this would be especially if you're returning back to work. So if you're unable to breastfeed directly, it's important to express milk as frequently as you would have breastfed with your baby. Before you do it, make sure you've got a hygienic and sterile area before expressing. And then if you're having difficulty to get the milk flowing, think about your baby, maybe pack in your baby's blanket or clothing that has your baby's scent on it. You can do some gentle massage and also gently rub your nipples for stimulation. So now there's 3 different ways that you can express your milk, so either by hand or by pump. So you've got your hand expression, your manual pump, and your electric breast pump. So with your hand expression, this means you literally use your own hands and you massage and compress the milk, the breast to remove the milk. So this takes a bit of practice, a bit of skill, but this is normally an option used if you are seldom away from your baby, and it is your cheapest option. The manual pump, so especially if you're returning back to work. So this is where you use your hands to operate a handheld device that pumps the milk. So again, it requires some practice, some skill. It is useful if you have occasional pumping, so if it's not as much, but it could also put you at high risk of breast infection. So this one, you can get away with 350 Rand to 1,500 Rand, depending on which brand you choose, but that's sort of the going rate. And then lastly, your electric breast pump. So this runs on battery, or you can plug into an electric outlet. So I'd say from my experience in hospital, most moms opt for the electric breast pump. It's maybe a lot more expensive, but it is easier for some moms. And then you have the option of pumping one breast at one time or both at the same time. So especially if you're working full time, what you can do is collect more milk in less time by pumping both breasts. And then just remember, you need a place to clean and store between uses, especially at work. Then storing your breast milk. So very important. So in a clean glass or a hard BPA-free plastic bottle. You can also use milk storage bags for freezing. So after each pump, label the date, your child's name. Very, very important. Never shake the milk. If it's in a bottle, if it's in a storage bag, you want to swirl the milk to mix, but the shaking can actually destroy the fine molecules in the milk. So a nice, easy swirl, and then refrigerate or chill for later feeding. If you're wanting to freeze your milk, so wait to tighten your bottle caps or lids until completely frozen. So you can almost half tie them, half close them, but wait until they're completely frozen to get the final close. And then store at the back of the freezer, so not in the door of the shelf. This just makes sure that the temperature is regulated probably the best at the back. And then when it's time to thaw the milk or warm it up, so after you've labeled them, you can see which is the oldest stored milk, so use that one first. And then you want to serve this milk at room temperature. So it's best to thaw overnight in the refrigerator, or you can thaw in setting it in a container of warm water. Never microwave it. This can also lead to sort of very hot patches and cold patches, and it will make your baby very unhappy, and also can be quite dangerous with burning them. Again, swirl the milk and then test it on your own wrist. So also important, use that milk within 24 hours. Don't refreeze it if you decide not to use it or if it's past the 24-hour mark. Then just a guideline for fresh expressed breast milk. So if you are placing it on the countertop table, you can store it at room temperature for up to 4 hours. So keep the container covered and just keep it as cool as possible. If it's stored in the refrigerator, the temperature will either be 4 degrees or colder, and you can store it for up to 3 days. But again, store it at the back of the fridge. So that's where the temperature is regulated the most. When we're talking about our freezer, this is at minus 17 degrees Celsius or colder. This can be stored for up to 3 to 6 months, and then stored at the back where it's the most constant. And then finally, our deep freezer. This is minus 20 degrees or colder. You can store it for up to 6 months, again at the back of the deep freeze. Then just the last guideline to storing thawed breast milk. So if you've started thawing the breast milk from the day before, you can keep it at room temperature for up to 2 hours is the best. 3 to 4 hours is pushing it, but it's okay. You can keep it in the refrigerator for up to 24 hours, and then do not refreeze the breast milk, rather discard it if you haven't used it. And then finally, just a take-home message. So breastfeeding should be a wonderful experience to bond with your baby. It will take practice, practice, practice. So don't give up, practice, consult a lactation consultant, a doctor, a physio, play around with a few different feeding positions and just see what works for you and your baby. Ensure your baby has a good latch. This will prevent most of the common challenges or complaints that we spoke about. Be aware of potential challenges. So those were the 7 different things I spoke about earlier, and how you can manage them and what to do if you start experiencing one of those challenges. And then, as mentioned, if you're struggling with anything, consult a healthcare professional. Very important, if you're returning to work, plan your return to work with your expressing and storage methods. So speak to your employer about a certain time you have to pump. Be very strict with yourself. So we said again, not more than 4 hours. And then take it easy in the beginning. Don't stress yourself out. Join support groups and speak to us, please.
Thank you for joining our webinar.